communicate an important decision that the NDC caucus in Parliament has reached. And that decision is that on the matter relating to the mysterious 150 United States dollar Frontiers Healthcare Services contract at the Kotoka International Airport dealing with antigen tests based on the evasiveness, the lack of candor, the lack of sincerity, and the outright refusal by nominees who should know about this contract, and the contradictions and the comedy of unreliable referrals that every nominee appears to be giving us. We have decided as a caucus that when the House reconvenes, we are going to move a motion demanding a full-scale inquiry, a bipartisan inquiry into the Frontiers Healthcare Services contract at the airport. As you have followed the proceedings of the Appointments Committee, the Health Minister was the first to be asked this question on the 10th of February. The Health Minister initially, after claiming he did not know anything about the contract, said that we should go and find out from the Presidential Task Force. In further inquiry at the Appointments Committee, he then revealed, that is after we have pointed out to him that the Presidential Task Force by the Procurement Act is not a procurement entity. He then said that this must have been carried out with the Ghana Health Service, because the Ghana Health Service is a procurement entity. That was with the Health Minister. Then it came to the time of the Honorable nominee for Attorney General, who significantly wears two hats. He is a member of the governing board of the Public Procurement Authority, and is also, by Article 8081, together with his boss, the principal legal advisors. Interestingly, they tell us that the Public Procurement Authority knows nothing about this. As a governing board member, he is not aware of this transaction. And as principal legal advisor, he also has not proffered any legal advice on this matter. Then you will recall that we sought to also find out from the Honorable Minister responsible for Foreign Affairs and Regional Integration. She had occupied the same position at all material moments when this contract was signed and executed at the airport. And one would have thought that since the Foreign Ministry pays particular attention to matters relating to foreign travel, our airport, and related matters, she will have some idea, or she will have been consulted. She told us emphatically that the Foreign Ministry was not consulted and that Ghana's Foreign Ministry knows nothing about this contract. Then yesterday, as you followed proceedings, we found out from the chief government spokesperson, the Honorable Kojo Opon Nkrumah, who was Minister of Information and who was a member of the Presidential Task Force. He told us that this is a matter that the Ghana Airport Company Limited is seized with. It is important for you to note that that is the third different entity that has been named. Initially, the Health Minister told us that Presidential Task Force and Ghana Health Service. The second different entity is when the Honorable Adjosafu appeared before us. She is the Chief Procurement Advisor to the President, the topmost and foremost procurement advisor to the President. She told us, as you recall, that the law was not amended, so the PPA is under the Ministry of Finance. So she referred us to the Minister responsible for Finance. Yesterday, we received a third referral a third entity, this time the Ghana Airport Company Limited. And we are told that we should wait for the transport minister. As I told the Honorable Information Minister, as he then was yesterday, if you tell us that this is a contract which was escalated beyond one ministry and that the Presidential Task Force took the lead in securing this contract, it is the very reason that multiple ministers should know about it. If you adopted a multi-sectoral approach in the contracting, logically, multiple ministers and agency heads, those who were part of the Presidential Task Force, should know about it. Why is everybody running away from accountability? Why is this contract steeped in so much mystery? We cannot understand. And that is why we have decided that we will move a motion when the House reconvenes for a full-scale inquiry into this matter. Already, we must emphasize that virtually all the laws have been broken so far as this particular Frontiers Healthcare Services contract is concerned. The Public Procurement Act requires, there are provisions in the Act, if you check Section 41, for periods of emergency, periods of catastrophe. The airport was closed on the 22nd of March, 2020, and opened after 6 months on the 1st of September. So there was enough time to have respected the provisions under the Public Procurement Act. The second law, which has been breached violently in this matter, is the Fees and Charges Act. Only this House, the Parliament of Ghana, can approve these levies. The $150 was not approved by Parliament. It was not approved by Parliament. The minister responsible should have come to Parliament with an ally. The Fees and Charges Act is very clear. So this $150 charge is illegal. It was not approved by the House. The third law, which has been flagrantly violated, is the Health Institutions and Facilities Act. And that law is very clear. Read Section 11 of the Act. You cannot operate any medical facility without a license from HEFRA. Our checks have indicated that HEFRA only licensed Frontiers on the 3rd of November. More than 2 months, and the health minister confirmed that he found out later that they were operating without a license. Now we are talking about human lives that are at stake. You are taking human samples and you do not license this entity. Now, beyond all these laws that have been broken, there's also the issue of quality assurance, compliance with standards. How sure are we that what they are even doing at the airport, the testing at the airport, is credible and that its efficacy is reliable? Any wonder that now Noguchi and the scientists, the other scientists at KCCR, Wakib and others are telling us that they have noted that the UK variant is now dominating this second wave of infections in Ghana. Any wonder? So this is a matter that borders on our survival. We're in the midst of a pandemic. COVID-19 is killing so many people. And we cannot afford to have these infractions and these breaches which will jeopardize human life and will put all of us at risk. It's a very, 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 very important issue that will not be swept under the carpet. So we are informing the country, the good people of Ghana, through you, that we are going to move a motion as soon as the House reconvenes. We are demanding a full parliamentary bipartisan inquiry into this scandal, and we will get to the bottom. We will know who is behind Frontiers. Why is it that this company, which has no track record, absolutely no track record in biomedical laboratory services, was hurriedly formed on the 21st of July During the airport closure period, when they knew that in a few weeks the airport will be reopened, they hurriedly incorporated this company on the 21st of July, 2020, and by 1st September, they had taken position at the airport without licensing, without following any of our laws. We want to know those who are responsible. So all these nominees who think that they may have gotten away at the appointments committee, we want to serve notice that nobody will successfully be allowed to evade accountability to the good people of this country. We thank you.